How to perform basic first aid. Knowing how to perform basic first aid can make a critical difference in emergency situations. Immediate and appropriate response can prevent minor injuries from becoming serious and can save lives. Here are the essential steps to perform basic first aid. First, assess the situation. Ensure the scene is safe for both you and the injured person. Check for hazards such as traffic, fire, or unstable structures. Once the area is secure, approach the injured person and determine their condition. Call emergency services if needed. For minor cuts and scrapes, start by washing your hands thoroughly to prevent infection. Clean the wound with mild soap and water, then apply an antibiotic ointment. Cover the wound with a sterile bandage to keep it protected and clean. In the case of a burn, the first step is to cool the affected area. Run cool, not cold, water over the burn for at least 10 minutes or apply a cool, wet cloth. Avoid using ice, as it can damage the skin. After cooling, cover the burn with a sterile, non-adhesive bandage or cloth to prevent infection. If someone is experiencing a nosebleed, have them sit down and lean slightly forward. Pinch the soft part of their nose, just below the bony bridge, for about 10 minutes. This pressure helps to stop the bleeding. Avoid having them tilt their head back, as this can cause blood to flow down the throat. For sprains and strains, remember the Rice method. Rest, ice, compression, and elevation. Rest the injured limb, apply ice to reduce swelling, use a compression bandage to provide support, and elevate the limb above heart level. This approach helps minimize swelling and promotes healing. Choking is a serious emergency that requires immediate action. If the person cannot cough, speak, or breathe, perform the Heimlich maneuver. Stand behind them, wrap your arms around their waist, and make a fist just above their navel. Grasp your fist with your other hand and perform quick, upward thrusts until the object is expelled. In cases of severe bleeding, apply direct pressure to the wound with a clean cloth or bandage. If the bleeding does not stop, add more cloths on top without removing the initial ones and continue to apply pressure. Elevate the injured area if possible and seek emergency medical assistance immediately. For someone who is unconscious and not breathing, begin CPR, cardiopulmonary resuscitation. Place the person on their back on a firm surface, kneel beside them, and place the heel of one hand on the center of their chest. Place your other hand on top, interlocking your fingers. Perform chest compressions at a rate of 100 to 120 per minute, allowing the chest to fully recoil between compressions. Knowing how to perform basic first aid can make a significant difference in an emergency. By staying calm, assessing the situation, and applying appropriate techniques, you can provide essential help until professional medical assistance arrives.